Good evening to one and all who has joined this live session on Facebook today. Welcome to you all to Ayu Health Dialogues. Ayu Health is a chain of high-quality hospitals with over 20 branches in Chandigarh and Bangalore. All hospitals practice the highest quality of medical standards and are accredited by NABH. Our heart is the most important organ of our body that carries so many vital functions such as carrying oxygen and nutrients to all parts of our body. Our lifestyle habits have a great impact on the heart, whether it could be the foods we consume, exercise, our sleep patterns, and certain other lifestyle aspects. Unhealthy lifestyle choices can have an impact on the heart health in a long run. Coronary artery disease is one of the common heart problems that has been on a significant rise over the past few years. Today with us, we have Dr. S.S Ramesh to talk about coronary artery disease and other heart problems. If you have any queries regarding this topic and other heart problems, please post your questions in the comment section. Dr. S.S Ramesh is a highly skilled cardiologist in Bangalore. He holds an experience of 47 years in medical field. He completed his DM Cardiology from University of Bombay, MD General Medicine and MBBS from University of Mysore. Hello, Doctor. Welcome to Ayu Health Dialogues. We are glad to have you here on this webinar, Doctor.
Thank you.
To start with, Doctor, can you please tell us what is coronary artery disease?
Yeah, see, the heart, though the entire blood in the body goes through the heart, there's nearly about 5 liters per minute, but its own functioning, and depending upon small blood vessels, is called coronary arteries. They are about 2.5 millimeter to 3 millimeter in size on the surface of the heart. And these blood vessels supply the nutrition and oxygen to the heart muscle. These are called coronary arteries. Now, these coronary arteries, normally, they are very smooth. Inside of the vessel is very smooth. And the blood flow is uninterrupted and continuous. But due to various factors, over the time, the blood vessel, inside the blood vessel, there is some kind of a clogging and narrowing of blood vessel, what we call a hardening of blood vessels, and medical term we call atherosclerosis, wherein cholesterol, calcium, and other things get deposited, and the lumen of the blood vessel gradually gets narrowed. So this narrowing is when there is a disease in the coronary arteries, is what we call coronary artery disease. It varies. Normally it's the age-related phenomenon. Almost everybody after the age of 75, 80, there is some thickening and hardening of the blood vessel. But in some individual, this blockage or this narrowing occurs much earlier. Now, there are certain known factors which increase the chance of this kind of narrowing happening. There are commonest in India is diabetes, that is people with blood sugar. Diabetes mellitus is one of the common factors, especially above the age of 45, 50. It's very common to have these blockages very early. So much so, we say that if there is a diabetes for more than 5 years, almost 80% chance that they will have some blockage of blood vessels. It is that common. And that is the reason there is an alarming situation in India, because India is considered as diabetic capital of the world, because we have a very high number of people with diabetes compared to the Western countries. According to one study in Chennai, almost 1 in 4 adults have diabetes in India. Adults. So that is the commonest cause for this narrowing. Second cause, of course, is common both in West and India, is cholesterol, high cholesterol. Of course, in India, there is also a little difference in this cholesterol distribution. Normally, we have things called total cholesterol, and we have LDL cholesterol, we have HDL cholesterol, and called VLDL cholesterol, and then triglycerides. Western countries, it is very common to see LDL cholesterol being very high and total cholesterol being high. LDL cholesterol is the one which actually causes the damage to the blood vessel and causes the narrowing. There is something called HDL cholesterol, which actually removes the cholesterol from the blood vessel and actually protects against atherosclerosis. Triglycerides are again, high triglycerides will again cause damage to the blood vessel. In India, the common pattern that is seen is a low HDL cholesterol and high triglycerides. Because of the low HDL cholesterol, the protection against atherosclerosis is removed. So that is how we say that there is a high incidence of atherosclerosis among Indians. This is something called metabolic syndrome. They're all clubbed together, like diabetes, being overweight, what you call obesity, especially the fat around the stomach, less fat in the legs and the arms, more fat around the stomach. That is again a typical pattern among Indians. So obesity, diabetes mellitus, and this low HDL cholesterol, high triglycerides, and insulin resistance. There is some resistance to insulin. These are generally called as metabolic syndrome, and that is very common among Indians. It is supposed to be a genetic predisposition that we have among Indians. That is how you see a very high incidence of obesity, high incidence of diabetes, high incidence of atherosclerosis and heart disease.
Yes.
Then, of course, high blood pressure also contributes to atherosclerosis. Being sedentary itself increases the chance of atherosclerosis. And the lack of exercise and overweight, obesity, this increases exercise. Now, another biggest problem or a major risk factor, I would rather say next to diabetes, that is a major risk factor among Indians, is tobacco usage, especially tobacco smoking, cigarettes, BDs, and various kind of tobacco products. They all increase the incidence of narrowing of the blood vessel. What is also alarming is that in younger age group, below the age of 40, see, normally all these diseases, diabetes, atherosclerosis, heart attack, are common above the age of 45. But tobacco is the one that causes the heart attack or the narrowing to occur much before the 40 years. So much so that we believe that anybody below the age of 40 coming with heart attack, unless proved otherwise, we believe that he is a smoker. It is that common. So tobacco usage is one of the major risk factors for heart problems. Now, this is also a deadly combination. Tobacco usage and diabetes is very common. Indians now, the rest of the world, especially Western countries, the tobacco usage is coming down. But India actually is on the increase because part of the reasons is the government encourages tobacco growing because it is a good source of revenue for the government. And because of increased tobacco production, there is much more consumption of tobacco products in India. And also alarming is that as per WHO criteria, more and more young people they have taken up tobacco smoking. To an extent, now they say the first use of tobacco starts in middle school in India. A lot of children have started using tobacco. That is alarming because longer somebody uses tobacco, there is a higher incidence of heart problems.
Yes.
And It is very common. It is not that uncommon at all. You go to any hospital, in a week at least you will see somebody less than 40 years of age with a heart attack.
So, doctor, can we say that family history or hereditary be a cause of heart disease in the next generation people?
Yeah, it is very common. The youngest person with heart problem I have seen is at the 19 years old, a major heart attack. Again, tobacco usage is the biggest problem. Then there are few risk factors. One is family history. There are some, there is also some genetic component. There are some people in the family, multiple people with heart problem. So when there is such a family history, the risk of somebody developing a heart attack at an earlier age is high, or blockages are high. Age is another factor. Older the person gets, the chance of again heart attacks or heart problems are higher. Being a male itself is a risk factor. Again, heart attacks are more common among men compared to women. Women definitely till the age of 45, till they attain menopause, are somehow protected because of the hormones. After the age of 45, of course, if they have diabetes or high blood pressure, their chance of developing heart problems are as much as men. But generally, men have a higher incidence. So being born a male itself is a risk factor for a heart problem. So these three, age, male, and family history, we say these are all non-reversible risk factors. Nothing can be done about it. Rest of it can be altered. Other risk factors can be altered. Definitely one should stop smoking. You can control diabetes better, get into regular exercise program, reduce the weight, control the blood pressure, control the cholesterol. Dietary intake of fat can be reduced, cholesterol can be controlled. So with these measures, definitely we can reduce the chance of somebody developing a heart problem.
So, doctor, how can we identify that we are at a risk of CAD? Like, are there any significant signs and symptoms that we can know that in much prior, or maybe during our daily activities? Can we have any symptoms, prominent symptoms by which we can identify that?
Yeah, one of the common symptoms of a heart problem are chest pain. And somebody walks or climbs steps or exerts, if they start developing some kind of a discomfort in the chest and or some sort of a heavy feeling on the chest, probably. Not all chest pains are due to heart problems, but if something related to exercise, the chances of it being related to heart are very high. Again, diabetics are an exception. Diabetics may not have very classical symptoms of chest pain. They may have some shortness of breath or some vague discomfort in the chest and that kind of a thing. So, but in diabetes, since we know that the chance of heart problems are high, we usually ask them to check up regularly, much more often rather than a non-diabetic. But common symptom is the chest discomfort on exertion. There is a small group of people who have no symptoms and suddenly come with heart attack, but majority will have chest discomfort on exertion. So that is the first sign saying that yes, maybe there is a problem. So then what we do, one is to confirm whether it is related to heart. You take an ECG. If there are changes in the ECG, that means the probability already there is some damage to the heart muscle or something like that. But a normal ECG does not really rule out a heart problem because at rest, the blood flow can be still adequate. Then we do something called echocardiogram where it will see whether there is any damage to the heart muscle, whether the heart function has reduced or what. But to really diagnose whether there's a blockage or something, what we could do stress test. We make them exercise and take an ECG. There are various types. Common is take an ECG during exercise and see whether any changes happen. But sometimes we do some sort of what you call stress echo, and sort of increase the heart rate or exercise, and then by echo we can make out whether there is evidence of decreased blood supply. Sometimes we do a called radionuclide stress study, which is much more sensitive and only 95% chance of early detection. So this is how we do these tests to find out whether there's a problem. If there is some indication that there is a blockage or problem, then of course we do an angiogram and then see whether there's any relief blockage or anything like that. Of course, there are two types of angiogram. One is a conventional angiogram where when we put in a catheter and inject a dye or contrast, and we can visualize. Nowadays, another popular thing is what they call CT angio. But CT angio is, yes, it can tell whether it is normal or there is some abnormality. When CT angio is abnormal, we cannot really assess how severe it is, how severe is the narrowing or what should be done. If CT angio is abnormal, then we again do a regular angio to confirm the findings and then decide further what to be done. In a heart attack, the same discomfort is prolonged. When somebody has a heart attack, he has severe chest discomfort, unbearable. It is very severe, as if there is a very heavy feeling or something heavy is kept on the chest. They may have pain going to the hands, neck, head, or upper part of the stomach. They have profuse sweating. They have difficulty in breathing. I mean, these are all signs and fine. The problem is much more and it is prolonged. Normally, with the angina, what we call, just a blockage, but there's no total cutoff of blood supply. When they walk, they get discomfort. When they rest, they become all right. But if there's a heart attack, when there's a total blockage of blood vessel with clot, then the discomfort is prolonged. It doesn't stop at all. So then, of course, we immediately do an ECG, and of course, we confirm with a blood test called enzymes cardiac. So then we take further action on that.
So,
now,
doctor,
plus, of course, whenever a person has suggestion, or we feel person is at high risk, for example, is a diabetes or a smoker, what we do, we also do other tests, like we need to check his cholesterol, we check his sugar, we check his hemoglobin, we check his kidney function. Because if the cholesterol is high, if the sugars are high, then we know that he is at high risk of developing, so he needs further evaluation or more frequent evaluation, like that. If he doesn't have diabetes, he has no risk factor. Once we do the test and if they're normal, we may repeat it only after 3 or 4 years. But even a diabetic, we almost do it every year because there it is very common. A negative stuff doesn't mean that next year he won't develop. Same thing with smokers. Because if they continue to smoke, the risk continues and the risk becomes high. So in those people, we test them more often for these things.
Okay. So doctor, as you have closely associated diabetes, people having the risk of heart disease. So we have we call it something like pre-diabetic stage, we see the people who are at a risk of diabetes in near future. So it is a first stage of diabetes, we call it. So is there anything related to the heart disease? Like, are there any stages of heart disease, or it is the severe one that we get directly?
No, that's not true. See, that there are stages in the sense the narrowing starts happening, if there's a diabetes or something, but the narrowing may not be significant. See, unless the blood flow is compromised or the lumen of the blood vessel is compromised more than 70%, they may not have any ill effects of the narrowing. So, very early stage. Of course, there are many tests now to see there is an early detection. One is what we call calcium scoring by CT scan. We are still searching for a, not very expensive and routinely can be done. There is something called carotid intima media thickness, CT scan of the heart showing calcium scoring. There are a few tests like that, but at the moment, routine screening of people who have no symptoms, and if they want to know whether they have early disease. We don't have any inexpensive CT scoring. Calcium scoring is one of the best now available to see whether there is an early onset of the disease. Moment it crosses the 70% luminal narrowing, then various kinds of stressors can clearly show us whether there is a blockage. If we ignore that and if we allow it to continue and suddenly the total blockage, then of course ECG will show whether there is a heart attack, and then of course now we do the angiogram on them and see whether there is a blockage and immediately do an angioplasty. Of course, with a heart attack, there are other kinds of treatment available now. Earlier, we used to just give what we call thrombolysis. We dissolve the clot by an injection and then plan for an angiogram. But now we have found it is not very effective. It's only effective on 50-60% of the people. The remaining 40%, it may not work. So, ideally, every patient with heart attack should undergo an angiogram and what we call primary angioplasty, direct angiogram. Unfortunately, it's still a little expensive at this stage, but that is the best way to do it because otherwise, once the damage to the muscle happens, it's very difficult to repair. It may not be repaired and permanent damage to the heart happens. So we often ask them to get an angiogram immediately and do an angioplasty. Of course, with the now government regulation of controlling the price of the stent, it is definitely more affordable now. Earlier stents were about 80,000, 1 lakh and 1,20,000. Now all stents are priced at 32,000. So it is much less expensive compared to say 4-5 years back. So it's ideal. Every patient with heart attack reaches the hospital early and immediately diagnose and then get an angiogram and an angioplasty.
So, doctor, as you were saying, like chest pain is one of the most common symptom for underlying heart disease. So, if suppose the patient gets diagnosed the heart disease much in prior before it becomes serious, so can heart disease be treated with medications alone, doctor?
Yeah. Not all. Every heart problem need not be, undergo an angiogram and angioplasty. But what we usually do is we do an angiogram to assess the narrowing. If there is a small blood vessel narrowing or very minimal narrowing, then we put them on medication. And many times while waiting for angiogram, we put them on medication. There are many drugs which will help in reducing the load on the heart and thereby reducing the pain. And also, we give them so-called antiplatelets, aspirin and something called clopidogrel and other drugs, which will prevent the clot happening. So there are these drugs available. Not every patient who undergoes an angiogram. Actually, in my experience, about 30 to 40% of the patients who undergo an angiogram will not need anything more. They will just put on medical treatment and continue for a long time. When the symptoms become more severe, again, we may have to repeat an angiogram and see whether the blockage has increased, and then, if necessary, then only do angioplasty or surgery.
Yes. So, and also at times people tend to ignore the symptoms. Like they might have profuse sweating and chest pain, but still they ignore, like thinking that it might be due to work pressure or something like that. They don't go for a doctor checkup immediately. So in such cases, what would be the complications? Like if they ignore the symptoms suddenly, can that lead to any complications in future?
Oh, yes, that's what I say. If they ignore and if the blockage progresses and totally blocks, they will end up with a major heart attack. And or sometimes what happens, especially in diabetics, we slowly the blockage happens and small mild heart attacks happen in the heart, what we call microinfarcts, and suddenly we find the heart bulged out. Heart function severely reduced, and they start having difficulty in breathing and other things. So I mean, see, unlike before, heart disease is no more a fashion or it is not a curiosity. It's very common. So actually, it is considered the single largest cause for the what you call morbidity and mortality. That means death rate in the world. And same thing in India. Nearly 40% of the deaths happen due to these blockages of blood vessels. I mean, it is not a small number. Uh, I mean, of course, West probably accident and cancer almost come close, but in India, heart disease is the commonest. Then comes accident, and then comes cancer, and then comes other diseases. So it is very common. I don't think anybody today should ignore. Because now we have tools to detect early, treat these things so that basically avoid the damage to the muscle. Now, because when the heart is basically a pump, if the pump is damaged, it is a permanent damage and they keep on having problems. So we need to intervene early, either with medication or with angioplasty or with surgery, so that the blood flow is restored and they become better. And another important thing is lifestyle modification. I mean, that I think I would like also again, as I started in the beginning, again, I would like to stress that is an important part. Whether a patient is on medical treatment, angioplasty or surgery, lifestyle modification is important. I mean, just because I do an angioplasty or there is a surgery doesn't mean that he can continue to smoke, he can continue to have uncontrolled diabetes or eat anything that they want. All that. I mean, you have to control. They have to stop smoking. They have to reduce their weight. Reduce the fat content in the body. Control the diabetes well. Control the blood pressure well. Control the cholesterol. Lead an active life. It is possible. I mean, I often say, many people ask, "Oh, will I be all right?" I said, the Prime Minister of the country, he underwent twice coronary artery bypass surgery, Manmohan Singh, and continue to rule the country. So it is possible. N.T. Ramarao also underwent coronary artery bypass surgery and continue as the Chief Minister. Narasimha Rao also as the Prime Minister, he had a bypass surgery and continue. So it is possible to lead a normal life after these treatments. But you also have to control so that it doesn't recur. They have to change their lifestyle, improve their diet, get into regular exercise, reduce the weight, keep it optimal, control the diabetes well, stop smoking, control the blood pressure. I mean, that they are important. I mean, at all stages of heart disease, lifestyle modification is an important part of the treatment.
Doctor, what are the treatment options that are available currently for coronary artery disease?
It depends on what stage we see. For example, as I said earlier, that if it is early or mild symptoms, we just put them on something called drugs, medications, which will reduce the demand of the heart, as well as put them on antiplatelets so that the blockages don't happen, or sudden blockages don't happen. And with lifestyle modification, there have been a lot of reports already indicating saying that if you control your risk factors, you can reduce the blockages. What you call reverse modeling. I mean, you can actually reduce the atherosclerosis if you control it long enough. So it is possible. So we put them on that. But once they have symptoms or once we say they have significant blockages, then of course we have, again, three options. We first do an angiogram and see what is the blood. If it is what you call diffuse disease, or if it is a small blood vessel blockage, then we put them on medical treatment again, aggressive statins. There is something called statins, which not only reduce the cholesterol, also reduce the chance of the blockages. Then, of course, control of diabetes and all those. But if the blockages are made of blood vessels and technically feasible, then we say angioplasty. And now with angioplasty, we have what we call drug-coated stents, which will prevent the re-narrowing of the blood vessels. Earlier we had a balloon or this one where the chance of re-narrowing was very high. Now with drug-coated stents, that chance has significantly come down. And now with the cost also coming down, it's a very good viable option. But there are certain situations where the disease is diffuse or multiple blockages and all those things, and diabetes. Then we say bypass surgery, coronary artery bypass, that surgery is an option. Of course, in all the three, concurrently, we also give some medication. It's not that only we just put a balloon and nothing else, because the stent is there, metal is there. So to prevent that metal to block, we put them on medication. Similarly, bypass surgery, the grafts can close. They have to take some medication. Plus associate factors like cholesterol. For statins, we give to cholesterol, sugar to control, sugar medication, blood pressure to be controlled. All those things also will run concurrent. So that's how we say. Of course, if the heart function is reduced, there are specific medications now to improve the function of the heart. So those medicines also we give. I mean, compared to say 15, 20 years back, definitely at any stage, the patients can look forward to a better life and a longer life now with the various kinds of medications available and interventions available. It is possible. But people should be conscious of it. I mean, basically that has become the problem. If people are aware that these are possible, this can happen, take preventive actions or modify their lifestyle, definitely we can reduce this disease burden.
Yes.
It's not impossible. It's possible. It can be done. So I would really suggest that, I mean, what we usually recommend is every person above the age of 40 should get once a full checkup done. The one IU Health has tied up with the Vegas hospital wherein all these tests can be done, health checkups and all that. So people have tied up there, and all the tests which are necessary or which will tell us whether there is some risk factors and all. That will help. Now, after that, we always advise them, it depends on, if suppose there is a high cholesterol, then every year they must check the cholesterol. If they have diabetes, of course, now we say diabetes, whether even if there is no diabetes, because there is a very high incidence, we say every 6 months minimum, they must check their sugar. There is something called glycosylated hemoglobin, or HbA1c commonly called. That gives an average sugar of the last previous 3 months. So that gives a good indicator whether they have diabetic or, because at any given moment, the sugar could be normal. Suppose somebody is fasting for about 14 hours, the morning sugar could be normal. It doesn't mean he's not a diabetic. So we always look at nowadays something called glycosylated hemoglobin, or HbA1c. So we insist that every Indian, every 6 months must get their HbA1c done. The blood pressure is normal. Again, at least once in 6 months, they must get their blood pressure checked after the age of 40. If they have diabetes, if they have any of the other risk factors, then once a year, they must get full checkup done. Cholesterol, stress test, echo, everything. But if they have no risk factors, nothing at all, except for sugar, rest of it, probably we can do it once in 3 years or 4 years. Because today everything could be normal, but after 1 year, 2 years, it can come up. But the sugar is one we now insist in India, that whether there is a family history of diabetes, whether a person has symptoms, no symptoms, we insist that every 6 months, everybody should get sugar checked. That is how we can detect diabetes early and correct it or control it better. I mean, this is what we follow. And for a diabetes, every year we say echo and treadmill test. Non-diabetics, if everything is negative, maybe once in 3 years or 4 years, you can get these tests done. So depending upon the risk factors, we decide. If it's a smoker, again, we say every year you must get it checked. So like this, depending on the risk factor, we assess the risk factor. The tests I told you, the cardiac health checkup package that you people have got it with Vegas Hospital. That has all these components. So that will tell us what is the risk of somebody getting a problem. And then with that, we can detect and assess the risk of a person. And depending on that, we advise for what.
Doctor, the person is already diagnosed with CAD, and what is the probability of the same person getting it again? Like, what is the probability of reoccurrence of coronary artery disease for the same person?
It's common. See, we always say coronary artery disease is almost like cancer. It is a low-grade cancer, as we call, because the disease process can continue. It all depends upon the risk profile. Doesn't then diabetics continue to have the risk if they don't control sugar well? They continue to have the risk of recurrent events happening. If they continue to smoke, it can keep on. If the cholesterol is not well controlled, they don't take medication, the risk is still there. So it all depends upon those factors. And in spite of in some people, it's a genetic component wherein in spite of the full treatment schedule, they can keep on coming back with, because heart has 3 main blood vessels and the branches and all. So each blood vessel can get affected at different times. For example, angioplasty, I may treat one blood vessel, he may come back with a blockage in other blood vessels. So it is possible. So the only way is this one, continuous lifestyle modification, control of risk factors, and take regular medication and regular checkup. That is the only way we can, at least arrest the progression of the disease.
So, doctor, you have mentioned a couple of times that dietary modifications and lifestyle modification exercises can prevent the risk of heart diseases. But there are a few people who exercise almost every single day, follow a strict diet, but still are at a risk of heart disease. Suddenly, one day they end up having a heart attack. So what may be the underlying reason for such people getting a risk of heart attack?
Yeah, that's what we see this in about 10% of the people with heart attack. We do see people no risk factors at all, nothing. We still are in search. I mean, there is some risk factor, whether it is genetic or there is some factor. We don't know. So, I mean, the search is on, but we do see 10%. I mean, bad luck, but I mean, those people, it is very difficult also, to know in advance whether they will develop. Because routine CT screening of every individual is prohibitively expensive. I mean, it's not possible, easy. For this population, we can't screen everybody for heart problem. Only those with risk factor we can. So because of that, I mean, people should be conscious. And yes, there are some still people who with no risk factor end up with heart attack, bad luck. I mean, we have looked at it, something called homocysteine levels are high, and some but still don't have a clear-cut answer in this about 10%.
Doctor, do you recommend any inclusions in the regular diet so that people can be safe and be preventive of heart diseases?
Yeah, one of the best things, as a cardiologist, we always say vegetarian food is the best food. Basically because the vegetarians have less fat in their food compared to a non-vegetarian. Of course, general advice we will say is avoid refined sugars, too much of refined sugars, because it has been shown that refined sugar increases the chance of diabetes. So we always say complex carbohydrates are better. And that is why we say vegetarian is better, because most of the vegetable or the fruit products have complex carbohydrates, wheat or jowar or there's millets and ragi, everything. They're all complex carbohydrates. Increased fiber content in the food. Like that's why we, earlier we used to say pounded rice is better than the milled rice. Because once the husk of the rice is removed, it becomes, the fiber is gone. So, whereas in wheat, the husk still remains. So, that's it. That is how the wheat has more complex carbohydrate compared to the rice. So, more fiber content. Again, all vegetable products, leafy vegetables, spinach, and all those things, or any vegetable will have a lot of fibers in them. Beans and everything will have a lot of fiber in them. The increased fiber content in the food reduces the cholesterol level. And that is how it is considered beneficial. It is also considered beneficial for diabetes control. Because most of these with high fiber content, your appetite fills faster. You don't eat over too much. And thereby your dietary intake is controlled. So thereby the sugar also comes under control. Then the fat. See, we say, any vegetable oil again is good. The only problem is when you boil it. See, there is something called saturated fat, unsaturated fat. And again, the unsaturated fat is monounsaturated and all those things. Now, more unsaturated fat in the oil, it is better. More saturated, fatty acids or something called trans fatty acids. They cause a lot of problems, increase in LDL cholesterol and other cirrhosis. So once you boil the oil, there is more trans fatty acids and more saturated fatty acids. So that is how we generally say avoid fried food. Because any fried food, the oil is boiled. And once you boil, that advantage is gone. Among non-vegetarian, fish oil is again very rich in so-called omega fatty acids, that is unsaturated fat. So fish oils are good. They are beneficial for the health. Among the non-vegetarian food, the red meat is bad. Red meat definitely has more high cholesterol. So like mutton, any kind of mutton, all that. It's rich in cholesterol. Whereas white meat, like chicken or fish, is very good. Again, fish is very good because fish has a lot of unsaturated fatty acids and more proteins, less carbohydrate and less in fat. So we always say chicken and fish. If you're a non-vegetarian, chicken and fish are the best. The pork meat is an exception. Though it is a white meat, again, it is very rich in cholesterol. So we don't advise pork meat eating. It is very rich in cholesterol. Organ meats like liver, brain, kidney, and all those, again, very rich in cholesterol. Shellfishes are again rich in cholesterol. So those are the things generally we say avoid. And similarly, yolk of an egg contains high cholesterol. The white of an egg is good. It has a lot of calcium and protein, but yolk has more proteins also, but also more fat. So, again, all these in small quantities are fine, but somebody indulging in excess is definitely bad. And even chicken and fish, we say you should cook fish or cooked chicken is better than a fried chicken or fried fish. Once you fry, they all get converted into saturated fats, and that is how it is bad. So these are the general diet: more fiber, less refined sugar, less fat is a good, sort of. Vegetable oil just used, like, for food you directly add or small garnishing, it's not a big issue. But, once you boil, like vada or pakoda or that kind of a thing where you really boil, that is bad. That definitely increases the problem.
Thank you so much, doctor. That was really a very informative session, starting from how the coronary artery disease actually starts and risk factors, symptoms, to the dietary modifications that every individual has to start from today, right away, so that they can reduce the risk of heart diseases. So before we end here, doctor, what are the tests which if you can name a few tests which we need to undergo regularly, like as you mentioned, once in 6 months or 1 year?
Those are usually we say ECG, echo and treadmill test, or the common tests economical at the same time, they give you a lot of information. We would always recommend that. Of course, if there is a suspicion, then of course we do more tests and we get.
Thank you so much, doctor.
Sure. Thank you.
IU Health Hospitals, in association with Vegas Multi-Speciality Hospital, is providing cardiac profile health checkup that includes various tests that can identify the risk of heart diseases. To know more information on this, you can please call us on 6366 100 800. Thanks a lot for everybody who has attended this webinar session. Thanks a lot, doctor, for sharing such an information on cardiac diseases. Thanks a lot. Looking forward for many more sessions of IU Health Dialogues. Thank you all. Have a good evening.
Thank you very much.